caring for a premature newborn baby can be more demanding than caring for a full-term baby. Did you know that India has the highest number of babies who are born premature? Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss about premature babies and the special care they need in our today's episode. Joining our discussion today is Dr. Niranjan, Consultant Neonatologist from Yashoda Hospitals, Hyderabad. Welcome to the program, Doctor.
Thank you.
So, Doctor, according to recent statistics, India has the highest number of preterm babies born. So, what exactly do we mean by preterm, Doctor?
ప్రీమెచ్యూర్ బేబీస్ అంటే ఏమైనా బేబీ 37 వీక్స్ అంటే ముంద పుట్టిన బేబీకి మనం ప్రీమెచ్యూర్ బేబీస్ అంటాము. ఈ ప్రీమెచ్యూర్ బేబీస్కి అకార్డింగ్ టు జెస్టేషన్ మనం 3 టైప్స్ లాగా మనము డివైడ్ చేస్తాము. ఇప్పుడు బేబీ 28 వీక్స్ అంటే ముంద పుట్టిన బేబీకి మనం ఎక్స్ట్రీమ్ ప్రీటర్మ్ బేబీస్ అంటాము. 28 వీక్స్ నుంచి 32 వీక్స్కే వెరీ ప్రీటర్మ్ బేబీస్ అంటాము. 32 నుంచి 36 వీక్స్ జెస్టేషన్ బేబీస్కి మనము moderate preterm అని మనం పిలుస్తాం.
So what are some potential risk factors for a mother especially that the chances of a preterm baby is born, Doctor?
ప్రీమెచ్యూర్ బేబీస్ ఎందుకు వస్తుందంటే మెయిన్లీగా ప్రెగ్నెన్సీ రిలేటెడ్ కాంప్లికేషన్. ఇఫ్ మదర్ హ్యావింగ్ సమ్ మెడికల్ రిలేటెడ్ ప్రాబ్లమ్స్ లైక్ ఎక్లంషియా, డయాబెటీస్, హైపర్టెన్షన్ అండ్ chorea amnitis, maternal UTI, and related to some fetal related problems, if a baby having any chromosome abnormalities and placenta related problems like placenta previa, any bleeding from the placenta, abrupta placenta, these are the risk factor will cause a premature deliveries.
So when we identify these risk factors in a mother, Doctor, what are some health issues that we could anticipate in this newborn baby, Doctor?
The premature babies, they'll have like physically handicapped and they'll face several problems at birth. The main problem is respiratory distress syndrome. It is occurs due to surfactant deficiency because the surfactant will be matured by 34 weeks of gestation. If any baby born before 34 weeks of gestation, they will not have a surfactant naturally. Those babies will develop a respiratory distress syndromes. Main important is they will have a intraventricular hemorrhage because their blood vessels will be very thin and easily they will develop a hemorrhages in the brain. And these premature babies' lungs are very immature. They may require a ventilation for a long period and their lung injury will be very common. Due to this, they develop a bronchopulmonary dysplasia in long term. And more important, in premature babies, they'll have less immunity. Due to less immunity, they may develop neonatal sepsis very early. And due to prolonged oxygenation, neonatal sepsis and blood transfusion, they'll have a long-term complication like retinopathy of prematurity and osteopenia of prematurity. These are the few problems we'll face in the premature babies.
So I'm sure preterm babies need more attention than a full-term baby. So what kind of special care do they need and what parameters do we actually look into?
See, the premature care, it is not only during the postnatal, the premature care, it requires during the antenatal period itself. During antenatal period, the most important to keep the baby in utero is very, very important. If you are anticipating any premature deliveries, uterine relaxants, if you're giving a uterine relaxant and prolong the delivery at least for 48 hours to complete the course of the steroid. And if you give an antenatal steroid for a premature anticipated deliveries, the lung will mature and we can prevent the interventions like surfactant therapy and a ventilation can prevent it by giving an antenatal steroid. And one more thing is very important is magnesium sulfate. Premature deliveries babies, if you give a magnesium sulfate, you can prevent a intraventricular hemorrhages. And then during delivery time also, if you do a delayed cord clamping, the chance of intraventricular hemorrhage will be less. And providing a CPAP in delivery room itself will avoid the ventilator intervention and surfactant interventions and can avoid it to the premature babies. Once a baby gets delivered, they require a special care. Most important is prevention of hypothermia. So premature babies have the skin is very premature and easily they'll have a hypothermia. Those babies under special care is required and you should nurse under incubator or radiant warmers. And they'll have premature babies will have a respiratory distress syndrome. If you develop a respiratory distress syndrome, you should ventilate the baby and you should give a surfactant intratracheally. And some premature babies, they'll have a prolonged ventilation babies, they'll have developed a bronchopulmonary dysplasia. Those babies may require postnatal steroids. premature babies will have a infection chances will be more. Those babies, we should give a IV antibiotics. So these are the special case care is needed for premature.
So discussing about nutrition in detail, doctor, how much nutrition would you recommend for preterm baby?
Definitely premature babies require aggressive nutrition. If the baby born before 32 week of gestation, will start a IV fluids. And any baby is born between 32 to 36 weeks will give either IV nutrition, otherwise will give a breastfeeding or palatal feeding, you will give it to 30 to 36 babies. Any baby born after 36 weeks, you can give a direct breastfeeding. According to SPEGAN guidelines for premature babies, at least minimum 190 to 200 ml per kg feed is required. And proteins is 4 to 4.5 gram of protein is required. Calcium supplement is around 120 to 140 milligram per kg. Calcium supplement is required for this baby. So less than 32 weeks babies, ఇలాంటి బేబీస్కి డైరెక్ట్ బ్రెస్ట్ ఫీడ్ తీసుకోవాలంటే ఆ బేబీస్కి ఓరోమోటర్ స్కిల్స్ అనేది డెవలప్ ఉంటుంది. అలాంటి బేబీస్కి మనము గ్యావేజ్ ఫీడింగ్ పెట్టి ఎవ్రీ 2 అవర్లీ విల్ గివ్ ఏ ఫీడ్ టు ది బేబీస్. ఒక్క టైము బేబీ మంచిగా ఫీడ్ తీసుకుంటుంది 32 వీక్స్ అయిన తర్వాత స్లోలీ మనం గ్యావేజ్ ఫీడింగ్ నుంచి పలాడ ఫీడింగ్ మనము ట్రాన్సిట్ చేస్తాం. ఇప్పుడు బేబీ ఈజ్ బిట్వీన్ 30 to 36 weeks will directly start a palliative feeding, and once baby is taking proper palliative feeding, to slowly we initiate a breastfeeding, will transit from the palliative feed to direct breastfeeding. If the baby born after 36 weeks, we can give directly breastfeeding because sucking, swallowing and respiratory coordination reflex will develop after 36 weeks. So directly you can give a breastfeeding to these babies.
So neonatal care advancements play an important role in ensuring the well-being of preterm babies. So what are some recent advancements in treatment of preterm babies, doctor?
Last 20 decades, there are a lot of advanced things are developed in the NSU. Few decades back, there is no treatment for respiratory distress syndrome for premature babies. Now, due to advancement in NSU, respiratory distress syndrome, RDS are easily treated by surfactant therapy, and high frequency ventilation facilities are available. For asphyxiate neonates, brain cooling, and then for neonatal seizure babies, continuous amplitude EEG monitorings. For a meconium aspiration with PPH and pulmonary hypertension babies, nitric oxides, and IV nutrition under total parental nutrition. These are and development supportive care. These are the advanced treatments are available for newborn babies.
So before we conclude, what message you would like to share with the audience out there, especially for preterm baby care, doctor?
In the modern era, premature babies can lead the normal life. With the advanced treatment, even with the 500 gram babies can survivable, and they can lead the normal life like a term babies. And the babies' attenders should not discourage, and they should be hopeful and courageous to face this problem. And premature babies' parents require extra emotional support and financial support during the NSU stay. And the NSU team and the nursing staff give extra care to these patient attenders regarding emotional support and financial.
So thank you, doctor. It was wonderful having you here on the program today.
Thank you.
So this brings us to the end of this episode. Thank you for tuning in, and remember, with the right support and care, premature babies can grow healthy too. Do join us for next week as well. Until then, take care and stay healthy. Thank you.